How much can I actually customize my smile when getting dental implants?
That is a fantastic question. I love this question. There is a process behind designing a new smile for you. Let me show you what that process looks like. So there are some games out there where you get to customize a video game character, and we get to do that with our patients' smiles. We get to actually customize each and every individual tooth in a patient to make sure it's in the right position, the right shape, size. We can do vampire teeth, yes. We can make them as white as snow. We can make them as dark as you want them to be. We can do basically any color, any size, any shape. I think the biggest misconception that patients might have about designing a smile is that everybody's going to get the same exact smile. No two patients are exactly the same, and you're going to have variances between the size and shape, position of the teeth, and really how the lips frame the smile itself. We have a way to do a facial analysis and really measure things out for the patient. We also have ways of looking at the patient's personality and determining what does the patient want to portray when they smile.
Are there places where they basically give everyone the same thing?
There are clinics out there where you can see that patients are getting the same smile. They're kind of forcing a patient to fit a mold. At Dental Implants GPS, we do not do that. We do not force the patient into a template or a mold. We call it the smile style when we're actually doing the facial analysis and designing a smile for a patient. We don't just look at the teeth and zoom in on the smile itself. We have to back out and make sure that it fits within the frame of the whole face. We're looking at the position of the eyes. Where's the horizontal line between the pupils of the eyes? Does that match the smile? Does it have a nice curve to the smile? What is the frame of the lips? How much distance is there between the nose and the chin? How much distance is there between the forehead or here and the bottom of the nose? We need to make sure that those are balanced. And so when we make a new smile, we have the ability to change all of it. So the smile style process begins with the x-rays that we get. We get a 3D facial CT scan, and that tells us where the bony structures are, where the teeth are, what good anatomy you have, and what type of conditions you have in the mouth, whether it be gum disease or broken down teeth. We also get a 3D facial photo, which will pair nicely with our CT scan. We can overlay them together so we have an actual 3D facial image that has color to it, and we can see where the smile is in relationship to the teeth. We also get 3D digital impressions of the upper jaw and the lower jaw, so we can see where the teeth are in minute detail to the micron. Then we do a facial analysis where we're measuring the whole face, whether it's here, 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 making sure that's balanced. We're looking at everything from the middle to the outer edges of the face to make sure things are nice and framed well. We want to measure how far apart your upper jaw is from your lower jaw to make sure we have enough space for the teeth in between. So we're doing a lot of these analyses around the teeth before we even get into the design of the teeth itself. And then once we get the facial analysis done, then we can talk about characterization of the teeth, the size of the teeth, the position of the teeth. When our patients come in to Dental Implants GPS and we're doing the smile style appointment with them, where we're actually designing the smile with the patient, we talk a lot about the position of the teeth. We talk to them about what are the aspects of their smile that you want to keep? What are the aspects of your smile that you want to change? And so we talk about the size of the teeth, the color or the shade of the teeth, the spacing of the teeth. Another thing that patients tend to find out is they realize over time as they age, the upper lip tends to sag a little bit more and relax down, and they show less tooth structure. And when that happens, they tend to get an aged look. To have a more youthful look, we want to show more teeth. And there's a couple of different ways of doing that. And we talk to them specifically about the position of the teeth. That can give a dramatic youthful appearance in the end.
Show me some of those models, like what are the starting points?
These are models that we have. These are just talking points to show different aspects of a smile design. Some of the models that we have here are more square in nature. Nobody has ever received exactly this smile. It doesn't work for everyone. There's also the round. You can kind of see how this one is a little bit more round in nature. So this is for comparing and contrasting a square set of teeth versus a round set of teeth. And so they kind of have an idea of what we mean when we use those words. These are the more dramatic of the natural colors. Just by making the teeth uniform in nature as far as color is concerned, makes it look a lot healthier. Even by having a natural color, which is more of the one in my left hand here, and this one over here, this lighter color is actually an unnatural bleach. However, when you put these actually into the smile, patients who get what we would consider the darker, more natural color, it actually looks more beautiful in my opinion, because this is unnatural. But there are patients out there that desire this and they can choose either one. Matching the white of the patient's eye is a good way to make sure that you're picking something that's true to nature. So in conclusion, it's not just about replacing teeth and just getting anything into your smile. It's really about the process of finding what's going to be the perfect fit, the perfect smile for each and every patient that comes in. So if you're looking for a new smile and you want to know what questions to ask, download our checklist and you'll know what questions to ask your provider when getting a brand new smile with full arch dental implants.